Bismillahirrahmanirrahim. My name is Adil Shabana. I'm Assistant Professor of Cardiology, October 6 University, and this is the second lecture regarding jugular venous, our neck vein examination for skill lab for fourth year. This lecture, we will talk about the jugular venous pressure. How can we measure it? As we said, the jugular venous pressure is the upper level of the oscillating column in the internal jugular vein, in the right internal jugular vein. So what are the steps of examination? In summary, first, positioning of the patient. Then, step 2, we look tangentially and try to find where is the pulsations. Confirm that this pulsation is venous and not arterial, and this is very important step. Then, determine where is the top or the highest point of this column or of this pulsation. And then we use two rulers to try to measure the vertical distance of this point till the sternal angle between, the vertical distance between the sternal angle and this point. And then we will add 5 to the result, and finally we can check for two things: hepatojugular reflux and the Kussmaul sign. Yes, I know it appears like Greek, but it is very easy maneuver. So let's talk about these one by one. Number 1, positioning of the patient. What is the ideal position of the patient in order to measure the neck vein, the jugular venous pressure accurately? The patient should be lying, of course, on the bed, and the head should be at 30 degrees up to 45 degrees. Between 30 and 45 degrees, this should be the position of the patient. Okay, and then when the patient is looking to the opposite side, you don't let the patient like make his muscles tense. He just slightly look to the left side, and then when you look, you should find the oscillations of the pulsations or oscillations of the neck veins. Sometimes, if the patient is hypovolemic, like patients after dehydrated or after bleeding, we cannot see the oscillations, we cannot see anything. In this case, you have to lower down the position of the patient. Even you can make him flat, you can make the angle even 0. Okay, so if we see this figure, the middle figure is around 60, this figure is around 30. So anyway, if at 30, 40, 50 you cannot see the neck veins, then you have to put the patient down more, up to 10 degrees or even flat. On the opposite side, if the patient is congested, like patients of heart failure, the GVP is very high, so even like in these positions, you see the pulsation, but you cannot detect the upper part because it is nearly in his ear, in the lobule of the ear. In this case, you can put the patient 90 degrees in order to try to see where is the height of the jugular venous pressure. So the usual position is around 30 to 45. If you cannot see any movement in the root of the neck, you can put the patient down more. But if you can see the pulsations or the waveforms, but it is very high up to his ear, you can put the patient at 90 degrees to try to see the neck veins. Strangely, in all cases, you will get the same jugular venous pressure distance. Okay, so this is the first thing we need to know, is that we put the patient, is the patient's position. Okay, step 2, as we said, after you put the patient in the position you want, you just let him turn his neck slightly towards the left, but not very, don't tense the sternomastoid. Then you look tangentially. Better to use light in order to try to find the pulsation. You will find some movement near the root of the neck. So we turn the patient's neck towards the left side. We look tangentially using light, and then we try to find the pulsations. After we find, usually we will find that in the area of the root of the neck, there is something moving. So we have to decide if this pulsation is arterial pulsation or venous pulsations, because these pulsations can be carotid pulsations. So after we look, we need to do two things. We press on the pulsation itself in order to see if it is felt or only we can see waves but it's not felt. The second thing is that we press on the root of the neck in order to see if this pulsation will disappear or not. So in general, carotid pulsations are palpable more than are palpable, but the jugular venous pulsations are not palpable. Pulsations of the carotids are independent of the position of the patient. They will not change if you change the patient position. They will not change with respiration. And if you press at the root of the neck, they will not change. But the jugular venous pulsation, you can see them, but when you put your finger, you will not palpate anything. And if you press on the root of the neck, the pulsation will disappear. It changes with respiration and it changes with positioning of the patient. Then step 4 is to measure the vertical distance. As we said, we need to measure the vertical distance between the top of the pulsation and the sternal angle. Of course, the sternal angle, it is very easy to get it because it is the prominence after the manubrium sterni. You will find a bony prominence, which is the sternal angle. So you put a vertical ruler at this side, and then you already checked where is the pulsation. Let's say that here is the upper part of the pulsation column. So you put another ruler or any object, any straight object, and you see, in order to see what is the level of this pulsation on the ruler. So let's say that this pulsation is around 6 centimeters or 5 centimeters above the sternal angle. Okay, so the jugular venous pressure is 4 or 5 centimeters above the sternal angle. Okay, and it is noticed that the sternal angle in all people, it is around 5 centimeters above the center of the right atrium. So if you add 5 to the number you already got from here to the measurement, now you have the jugular venous pulsation in centimeter water. So normally it should be around 7 to 8 centimeter water. Okay, so if we find it more than 8 above the right atrium, this means that there is high jugular venous pressure. Okay, so again you will use two rulers. One is vertical over the sternal angle, the other one is horizontal to at the top of the column of blood, or at the top of the pulsation you are seeing, in order to see the vertical distance between it and the sternal angle, and then you add 5 to it in order to get the jugular venous pulsation. If it is elevated, this is very important. If you find it more than 8 centimeters, it can be due to many things. For example, patients with hypervolemia, patients with superior vena cava obstruction, patients with tricuspid valve disease, pericardial diseases, right-sided failure, pulmonary hypertension. All these people will have high pressure inside the right atrium, so it can be reflected as high pressure inside the neck veins. Okay, the last remaining two steps is what we call hepatojugular reflux or abdominojugular reflux. What is this? Usually while you are looking at the pulsations, you put the palm of your right hand in the right upper quadrant of the abdomen for around 15 seconds. But first you have to ask the patient if he has pain or not. Okay, so don't cause pain to the patient. Then you put your hand and you look at the neck veins. Usually the jugular pressure will be slightly higher for a few seconds, then it will go down again. Okay, sometimes in some patients you will find that when you press on the abdomen, the GVP becomes high, and even after you remove your hand, it will remain high for some time. Okay, and this is usually maybe due to right-sided heart failure or due to tricuspid regurg. The last thing is Kussmaul sign. What is Kussmaul sign? Normally during inspiration, when you take a deep breath, more blood will go to the right atrium and right ventricle, so the neck veins will be, the pressure in the neck veins will be less, because more blood is going down to the heart. Okay, the venous return will be sucked. However, Kussmaul sign means when the patient takes deep breath, the neck veins become more engorged, which is a paradoxical increase in jugular venous pressure during inspiration. This can occur in many conditions, but the most important one is in constrictive pericarditis and restrictive cardiomyopathy. There are other things, other diseases which can cause the same, but usually we care about it, or we I mean, like, it's important in constrictive pericarditis. When the patient is asked to take a deep breath, you will find the neck veins are higher, not lower. So mainly in constrictive pericarditis. Let's see this video.
Here, so what do you notice?
So you can see the pulsations in the neck here.
Anyone know what this is?
This is the pulsation.
Is there some respiratory variation here?
Pulsations in the neck veins, and you will find that it's getting high and down with inspiration. He will put a mark now. Now here is the pulsation.
So there's the JVP, and when he takes a breath in, look at it climb all the way up the neck to the angle of the jaw.
The pulsation was it.
This is Kussmaul sign. What else do you notice about this gentleman's skin? What is this mark right here, right below the A wave in our logo? Anybody know what that is?
So pulsation was down here.
That circular mark there.
And with inspiration.
Yes, Mohammed, that's exactly right. This is a radiation tattoo. And how can you put that together with Kussmaul sign? Well, this gentleman had Hodgkin's lymphoma when he was a teenager, had radiation to the chest, and that led to constrictive pericarditis.
Thank you.